So welcome to today's webinar, which is on eyesight and diabetes and understanding the effects on driving. My name is Rob Hurd. I'm the chair and founder of the Older Drivers Forum, and I'll be your host today. I've just a little background about me. I was a police officer for 30 years, retired 2 years ago, and 27 years of my service was actually in the roads policing traffic department. So I've got a lot of knowledge on that sort of work. So just before we get started, I'm going to play you a little video. You may recognize this person. Her name is Valerie Singleton. First, we're going to see this very short message from Valerie. Valerie is a trusted and well-known journalist, travel writer, and TV presenter. Many of you will remember her from her appearances on Blue Peter, and you will never forget that little time when she had that baby elephant in the studio causing absolute chaos. Val is a keen supporter of older drivers and being one herself, and more recently she has worked closely with road safety and various different organisations, especially GEM Motoring Assist, where she's promoted safe driving into older age. So let's have a look at that video. I shall just get it up on my screen. Okay. There we go.
Hello, we're delighted that you can join today's webinar. This webinar is just one of several webinars taking place this week, hosted by the Older Drivers Forum. Each webinar is on a different subject and designed to help and support you to carry on driving safely for longer. This week of webinars is to support the Project Edward Week of Action titled Fit for the Road. Project Edward stands for Every Day Without a Road Death, and it's an annual UK-wide campaign for road safety. It's backed by government, the emergency services, highways agencies, road safety organisations, and British businesses. Shockingly, on average, 5 people a day are killed and around 150,000 people are injured each year on roads in Great Britain. Unfortunately, 20% of all deaths on our roads are older people. As older licence holders is increasing every year, fatalities for drivers aged 70 and over are forecast to increase by 22% by 2040. As an older driver myself, I am fully aware how we can't become complacent about our abilities. We all need to focus on our own road safety and making sure that we are fit for the road, not only to protect ourselves, but others. This week of webinars, I hope will give you lots of useful information and help us all become safer road users while supporting us to carry on driving safely for longer. I wish you all the very best, and please stay safe.
Well, thank you very much, Valerie, for that. That's much appreciated. And it's really good to have Valerie support all this week. And actually, if you missed, we did have a webinar with Valerie yesterday on dashcams, which is available to watch on the Older Drivers Forum website. So we have 2 speakers today and also a case study to play to you as well. So that will be interesting to see. This webinar, like I said, will give you a good guide about driving and making sure how important sight is to driving, but also how diabetes can affect our driving, but also how we can hopefully overcome such things. So our first speaker today is Henry Leonard, who will be talking about eyesight and driving. Henry is the head of clinical and regulatory of the Association of Optometrists, bit of a mouthful that one, and continues to work as an optometrist in the community practice. His work with the Association of Optometrists involves providing tailored clinical and regulatory advice to the AOP's members and drafting UK-wide guidance on a range of topics relevant to optometrists. Henry also acts as a media spokesman for the AOP and has been interviewed on national radio, television, and in print on a range of eye-related topics. In relation to vision and driving, Henry has been closely involved with the AOP's annual Don't Swerve a Sight Test campaign, which has included articles in print media and TV appearances on BBC and Sky News. Henry has also attended parliamentary roundtable events aimed at changing the law around vision and driving. So welcome, Henry. Really pleased to have you again to join us. So I shall hand over to you.
Thanks, Rob, and thank you very much for inviting me back again this year. It's a real pleasure to be back again. I'm just going to share my screen with everyone so I can get the presentation up here. Everyone can see that in a moment. So yes, I'm an optometrist and I do still see patients in practice now and then, but the main part of my role these days is giving advice to other optometrists from all over the UK. And one of the most common questions we get is about vision and driving, particularly optometrists who are seeing a patient in practice who may or may not be fit to drive visually and wanting some advice on how to manage that situation. So I have split the presentation today into 4 broad areas. I'm going to touch a little bit on why vision is important for safe driving. And then I want to talk a bit about the minimum legal standards that are required for driving. I'm going to talk a little bit about the role optometrists have in all of this. And then just at the end, I'm going to touch on the AOP's Don't Swerve a Sight Test campaign. So just to wake everyone up, if we could start with a quick poll, I want to ask the audience, have you had a sight test within the past 2 years? So if the audience wouldn't mind just selecting yes or no, that'd be really helpful. Thank you. I'll give that a few seconds for the results to come in. And the results are in. Thank you very much. So that's showing 86% of the audience have had a sight test within the past 2 years, 14% haven't. So that's really encouraging. And I think I'm very much preaching to the converted here. That's fantastic. So why is vision important for safe driving? And this sounds like a very obvious question. Of course, vision is important for safe driving. It's self-evident. But there's a few aspects to it that I want to just talk through. So what most people think of when we talk about vision is actually what optometrists would call visual acuity. It's how far down an eyesight chart you can see. And we're all familiar with that sort of letter chart that opticians have when you go for a sight test. And if you don't have good visual acuity, if there's a problem, well, there are various reasons for that. The most common, of course, is just uncorrected vision. So it's perhaps needing glasses or contact lenses. So that's bread and butter really for optometrists, correcting vision using glasses or contact lenses. But there are various eye conditions that can affect visual acuity as well. Of course, cataract is one of the most common. That's where the lens inside the eye becomes cloudy gradually over time. Macular degeneration is a very common condition, and we'll be hearing a little bit more about that in another presentation. With macular degeneration, it tends to affect, or it does affect the central retina, the high resolution color vision part of the retina. So it has a big effect on visual acuity. And there are 2 main types. There's a dry type, which comes on more gradually. It tends to be less severe in the early stages, but it's not treatable. And the difficulty there, of course, is that you can go through a very gradual change and perhaps not realize that you're dropping below the right standards. And there's another type, the wet macular degeneration, which is a much more sudden change. So that's something that most people notice straight away. And that one can be treated. There are treatments available for wet macular degeneration, but even so, it can have quite a big impact on vision. And diabetes as well, that's another condition that can affect the eyes, usually through diabetic retinopathy, where the blood vessels at the back of the eye become leaky and cause hemorrhaging at the back of the eye. But it's not just about visual acuity. Another really important part of vision for driving is visual fields, peripheral vision, how well you're seeing things at the side. So that's really important, of course, if you're needing to see cyclists coming out of side roads, you don't want to be missing that. The difficulty with visual field loss is that you don't always notice it's happening. And in fact, studies show that you can lose up to 40% of your peripheral vision without realizing. And it still surprises me in practice when patients come in, maybe who haven't had a sight test for decades, and realize there's something wrong with their vision, but they can't quite put their finger on it. And when we measure their peripheral vision, we sometimes find they've lost a great deal of side vision because it's happened gradually. And the most common reason for that is a condition called glaucoma, where the fluid pressure inside the eye builds up and it damages the nerve at the back of the eye. And you end up eventually, if it's not treated, with tunnel vision like this slide shows. Usually, though, it's picked up early, often by optometrists in the community. And in most cases, if we get it treated with eye drops or laser treatment, that can usually slow it down or stop it getting worse. So it's another reason why it's so important to have a regular sight test so we can pick these things up early. Diabetes also affects peripheral vision if you have diabetic retinopathy, and it tends to give you sort of patchy vision rather than the tunnel vision that we sometimes see with glaucoma. It's more a sort of patchy vision, but that can obviously still affect safe driving. Something else that we don't generally measure as optometrists very often is contrast sensitivity. This is how well you can see things, how well things stand out on a similar color background, a similar contrast background. And it's something I think we will start to measure more, because studies are increasingly showing that contrast sensitivity is really, really important for safe driving. And there are several conditions that affect this. Cataracts, because it makes the lens cloudy, it can give you misty vision, so that affects contrast sensitivity, particularly if you've got a winter sun, low in the sky, causing problems with glare. Corneal disease, so that's the front tissues of the eye, the clear transparent window into the eye. If there's any issues there that make the cornea cloudy, that also often affects contrast sensitivity. And again, our old friend diabetes, diabetic retinopathy, can also give you problems with contrast sensitivity. So not something that's generally measured, but I think it may well be measured in the future. So I'll talk a little bit about the minimum legal standards, the statutory standards for driving in the UK. And I'm talking here mainly about Group 1 drivers, car drivers, motorcyclists, what standards they're required to meet. And there are really 3 standards in law. You need to be able to read a number plate from 20 meters in good daylight, which in old money is 66 feet. You've also got to be able to read to a certain level on the standard letter chart, which I've put on the right side of the slide there. And the level is what we call 612, which is around about halfway down that letter chart on a normal optician's chart. Now, what's interesting is that if your vision is around about that level, you'll probably feel that that's a pretty high standard to meet. But people who have perhaps 20/20 vision, which is the penultimate line on the chart, will often feel that actually it's a very low standard, which seems to suggest that we sort of get used to what level of vision we have. No matter what your vision is, you sort of feel that that's normal. And the final requirement is that you must have an adequate field of vision. So that just goes back to the slide I was talking about, seeing things coming out of side roads and being able to pick up movement in your peripheral vision. I've just put a link there at the bottom of the slide to some information we've got for members of the public on the Association of Optometrists website about driving and vision standards, and it just sets out those legal requirements that you need to meet to be able to hold a driving license. So I'll talk a little bit about what optometrists do. Most people have obviously been to see an optometrist, so you'll have a good idea of this. I think the most important thing that we do is checking that people's eyes are healthy, because there's so many things that we can pick up, especially conditions like glaucoma, which you may not realize yourself anything's going wrong. Optometrists can often pick that up at an early stage and refer you to an eye doctor, an ophthalmologist, for treatment. So that's one of the most important things that we do in practice. And we also manage more sort of minor eye conditions, dry eyes and things like that. And of course, opticians, as everyone realizes, maximize vision with glasses. And that's a really important thing as well. We sometimes overlook that, but it's such a fundamental thing to make sure that your eyesight is corrected in quite a lot of cases. Particularly if you're long-sighted, you can go through a very gradual change as you get older, particularly after your mid-40s. And if you're long-sighted, you can just gradually get more long-sighted and your vision gradually drops, and you don't always realize it. And sometimes it's quite surprising when people come in having not had a sight test for many years to realize that actually you've been missing out on quite a lot of vision that we can give you with glasses or contact lenses. I'm just going to talk a little bit also about legal responsibilities as well. So ultimately, drivers are responsible for reporting any medical conditions which may affect their fitness to drive to the responsible body, which is the DVLA in England, Scotland and Wales, and the DVA in Northern Ireland. And there is actually a list on the website of the DVLA, a list of health conditions which are notifiable. So it's really important to be aware of that. A lot of people have these conditions and they still meet the right standards, but there is that legal requirement to just let the DVLA or the DVA know about it. And it's the job of those bodies to decide if a person is medically fit to drive. And they may arrange further tests or request information from your doctor or your optometrist about that in order to make that decision. But healthcare professionals, such as optometrists, do have responsibilities as well. So the guidance from our regulator says that we should inform the DVLA or the DVA ourselves if we believe somebody may not be safe to drive. If there's a concern for road safety and that individual won't or can't inform the DVLA or the DVA themselves, then that's something that we do have to do. And I'm going to talk a little bit more about how we go about doing that sensitively. Obviously, driving and vision is a very emotive issue, and it's important that we're sensitive when we're communicating these kinds of issues. There are really 4 things that the DVLA ask healthcare professionals to do when it comes to driving and vision. The first is that we need to tell people about what impact their condition has for driving. So you might find if you have cataract, your optometrist talks to you about glare, difficulty with night driving, or driving when in autumn when the sun is low in the sky. With glaucoma, it may be discussions about peripheral vision, seeing things at the side. Macular degeneration, it tends to be, again, central visual acuity that's affected. And diabetes can affect all 3, really: visual acuity, peripheral vision, and it can also cause glare. The second thing that healthcare professionals are required to do is tell people about their obligations to notify the DVLA if they have a condition which needs to be notified. And in fact, the Association of Optometrists have published a leaflet that optometrists can give to patients with just tick boxes to show what the findings are, whether an individual met the standard on the day, whether they need glasses to meet that standard, whether they need to tell the DVLA about a visual field defect. And so that's quite a helpful resource. I've just put a link on the page there for anyone who wants to have a look at that. It just sets out the legal standards quite nice and clearly. And it's something that patients often ask, am I safe to drive? And so having this resource is really helpful, just setting out what you need to do. Now, most people, of course, are very sensible and they take our advice on board. If we say, actually, you don't meet driving standards, then they will do the right thing and notify the DVLA and stop driving. But occasionally, people don't want to stop driving. Perhaps that's because, it's about their independence, or it could even be about their livelihood. So we do sometimes have people that, even having been told that they don't meet the right standard, say that actually I'm going to carry on driving regardless. And we always try to give people an opportunity to do the right thing, to self-notify the DVLA. And so this is a template letter that we've drafted for optometrists to send out to those individuals to say, look, at your appointment, you didn't meet the right standards. You need to notify the DVLA. That's a legal requirement. Here's a link to the right form. We understand this is really difficult, and get in touch if you want to discuss it further, but this is what you need to do. The third thing that healthcare professionals need to do is monitor the condition with ongoing consideration of fitness to drive. So that's just recognizing that your fitness to drive can change over time, and it can go both ways. With things like macular degeneration, because it's a degenerative condition, even though you're within the standard, on one occasion, it may be that 6 months or a year later, things have progressed and you've just dropped slightly below that standard. But it can go the other way as well, of course, with things like cataract. Cataract is the most common operation on the NHS. So if the reason that you can't drive is because of cataract, it may well be that if you are referred and you have an operation, that you're then back within the right standards. So again, another reason to keep having regular checkups. And the fourth and final thing the DVLA ask healthcare professionals to do is also the most tricky, it's notifying them when a person will not or cannot notify the DVLA themselves. So this presents all healthcare professionals with a dilemma, because we have a duty of confidentiality to our patients. You know, we don't want to go behind someone's back and inform the DVLA that they can't drive, but at the same time, we've got a duty to them as road users, and also to the wider public interest. So this is a tricky one for optometrists and for GPs and all healthcare professionals. And so quite a lot of the work I do is discussing this on a case-by-case basis with optometrists who have a patient who doesn't meet the standards, and just deciding how to go about notifying the patient, giving them an opportunity to self-declare, and then if they choose not to do so, helping them notify the DVLA in line with their obligations. Finally, I'm just going to talk briefly about our campaign. So the Association of Optometrists has been running a driving campaign for the last few years called Don't Swerve a Sight Test. As you probably guessed, it's just to encourage people to keep going for regular sight tests, highlighting that there are quite a number of road casualties every year from drivers with poor vision, and optometrists are continuing to see patients driving who really shouldn't be. Part of the reason for this, we think, is that the UK has some of the most relaxed laws in Europe around driving and vision. So at the moment, you can pass your driving test at the age of 17 and then not need to have any further checks of your vision. And even when you get to the age of 70, it's simply a self-declaration to say, yes, I think my vision is still fine every 3 years after the age of 70, which we don't think is really good enough. We think that really you should be required to prove that your vision is up to scratch. In the same way that you have your car MOT'd, really eyesight should be checked regularly as well. And so we've been campaigning about this on national media and local media. And what we're calling for really is a change in the law. We would like to see a legal requirement for every driver to have a sight test at least once every 10 years. I mean, ideally, we'd recommend every 2 years. That's what we'd recommend if we're wanting to pick up conditions like glaucoma early and get them treated. But at least every 10 years, we'd pick up some of those gradual changes, and it would tie in with the license renewal process that's currently in place. The other issue that I want to talk about is compulsory reporting. And this is something that has come up in the national media when there's a particularly tragic case, if someone's been injured or killed by a driver with poor vision. Quite often the family understandably call for compulsory reporting from healthcare professionals to notify the DVLA whenever someone doesn't meet the standard. And it's something we've thought long and hard about, because on the one hand, in some ways that would make perfect sense, and lots of optometrists would like to do that, would like to have that in place, but we are concerned about unintended consequences. We think if that was a legal requirement, it may well put some people off having their eyes tested in the first place. So unless there was compulsory sight testing, we're not in favour of compulsory reporting, because we think that's not really in anyone's interest, and lots of eye disease is going to be missed if that's not put in place. And that brings me nicely onto the final poll. I wanted just to ask the audience whether you're in favour of regular sight tests for drivers. And Rob's just putting up the poll now. So it's just a simple yes, no answer. Are you in favour of regular sight tests for drivers? Just give that a few seconds for the results to come in. Oh, fantastic, 97%. Again, preaching to the converted. 97% of the audience are in favour of regular sight tests for drivers. Fantastic. And thank you very much for listening.
Well, thank you, Henry, for that absolutely wonderful talk, and really highlighting the importance of eyesight in driving. I mean, let's be honest, we need to see the hazards ahead of us. We need to be able to react to them. So got questions coming in for you. So we'll ask you, Henry, at the end of that. But thank you ever so much for that. And we'll have a more detailed chat about the importance of eyesight then. Thank you. Right. Well, that leads me on to our next bit, where I'm basically going to play a short video. Henry mentioned it. It's about a lady called Margaret Philly. Now, Margaret I know very well, and unfortunately she was diagnosed with macular degeneration. And Margaret very kindly agreed for us to follow her through her life or story about how it's affected her. And this really is the first of several videos that we'll be doing in the future with Margaret. But I think it's very kind of her to share her story with you. So let me just get that video up and I shall play it to you all.
We would like to introduce you to Margaret Philly, a lifelong motoring enthusiast who lives in Hampshire.
I am very nearly 80 and I'm very aware that personally I have eyesight problems, so I will have to make decisions about my life. But I want to help others make the right decisions for themselves, their family, and other people, but to still enjoy life.
Margaret knows that her days of being able to drive may be numbered because of an eyesight issue that's likely to get worse in the months and years to come.
I do have a degenerative eye condition, macular degeneration. I've also got cataract problems. Both my parents were registered blind for the last few years of their lives, so that I've always been aware that eyesight would be a problem. So I am tackling being carless, which could happen in another 6 months' time, with determination that my life will still be independent, interesting, and I can help make a difference to other people, which I love, even though driving won't be possible.
Let's meet the expert responsible for Margaret's ongoing eye care.
My name is Bryony Allen. I'm an optometrist and professional services manager for the Leighton's Opticians and Hearing Care Group. Mrs. Philly first came to Leighton's Opticians in our Camberley practice in 2019 and started to have her eye examinations with us at that point. And then she approached us to discuss safe driving with regards to vision.
Leighton's opticians diagnosed macular degeneration in Margaret, and they monitor this through thorough examinations every 6 months.
So macular degeneration is an age-related condition where the central part of the retina, the back surface of the eye, deteriorates as we get older. And it can cause some blurred vision, some visual disturbances, perhaps some lumpy bumpiness within the vision, and eventually can lead to a blank area within the central vision.
Is macular degeneration a condition drivers can spot for themselves?
People tend to know if they have a sudden change in their macula, so if they have a bleed on the back of the eye, which is a wet form of macular degeneration, this will often result in a sudden loss of vision. But the earlier stages of dry macular degeneration are often not detectable by the patient themselves, and it's only through monitoring and evaluating the health and the back of the eye that we can see those changes starting to occur even before the vision has become damaged in any way.
Bryony Allen is keen to point out the differences for people between being in the optician's consulting room and being at the wheel of a car.
So when we think about vision when we're driving compared to vision in the optometrist's consulting room, we're very much focusing on central detailed vision with letters in the chart, and then our field of vision, our peripheral vision in the consulting room. In reality, things move and change quite quickly out in the real world. So the vision that we can assess in a consulting room is really a snapshot at that moment in time and measuring detailed, concentrated vision and vision around the edges. What we're not able to look at is how quickly we're able to react when we do see something. So it's a good starting point, but it can't be the be-all and end-all.
And what does Bryony say to those drivers who feel it may be better to avoid an eye test in case there's bad news?
We advise everybody to have an eye examination at least every 2 years. As we get older, that becomes more and more important because vision changes gradually, and we don't notice one day we wake up and we've turned 50 or 60 or 70-year-old and suddenly think, oh goodness, my vision has changed overnight. You know, it's a little bit like we wake up on a birthday and we don't suddenly have a full head of grey hair. These things are very gradual changes. And so it's really important that there's an objective measurement at points in time, which is what an eye examination will do. Another key element is that vision and health are intrinsically linked but not mutually exclusive. So we can have a very healthy eye and poor vision, and we can have fantastic vision and an unhealthy eye. But if we have an unhealthy eye, it's likely to result in reduced vision over time. So the earlier that something is found, the more chance we have of dealing with it, whether it's a treatment, a management, or just counselling and understanding what's going on. So the key really is to have those regular examinations so that we can provide the best possible advice and care, both for the here and now and looking to the future as well.
The advice to get a regular eye test is supported by the police. Here's PC Liz Johnson, Road Safety Officer for Thames Valley and Hampshire Police.
Okay, as a mature driver, we would recommend that you have your eyes tested regularly. It's something that you may not realise that is deteriorating, so please do go and get your eyesight tested. Do check out these websites for older driver assessments. It might be that you're lacking in confidence, especially if you've not been driving for a while. So have an assessment, and then they will be able to give you tips that you may be lacking on and give you the confidence to be able to drive those journeys that you want to. We want to keep you safely on the road for longer.
Let's conclude this first meeting with Margaret Filley and find out what happened at her most recent eye examination.
I had my last 6-month appointment a week ago, and I have been told I am clear for the next 6 months. So I was very pleased that I'm going to be able to enjoy driving throughout 2021, but I know that I have to prepare myself for being carless.
We'll meet Margaret again in early 2022 to find out how her condition has developed and whether she is still safe to drive.
Well, what a very brave lady, and we really do appreciate Margaret sharing her story with us. And in later webinars in the future, we'll be following on Margaret's story. So thank you yet again. Right, well, that leads us on to our next speaker today. That's Professor Dilwyn Marple-Horvath, who will be talking about diabetes and the effect it can have on driving. Dilwyn is a professor of motor neurone science at Manchester Metropolitan University. His research investigates how the brain uses sensory information to guide what we do. Recent work has focused on the detection of impaired driving due to different factors, including alcohol, stress, and medical association with any impairment. So just before we get going, I agreed with Dilwyn that we would play or just do a couple of polls with you. So the first one we just want to ask you is, just bring it up on the screen. Do you actually have diabetes yourself? So if you'd just like to vote on that for us, a yes or a no would be great. Okay. No one seems to be voting at the moment. Rightio. I don't think anybody wants to tell us anything on this. So there we go. All right. Well, I shall leave that one for the second. I think you can all see it, but there we are. Right. The second one we're going to just play with you is just a poll that Dilwyn came up with, and I shall just launch this. We'll play it at the start this time, and we'll play it at the end to see what you think then. So this gives you an idea. Your wife says you're heavy on the pedal. You don't feel a stone in your shoe. Your doctor says some numbness. I'll contact the diabetes clinic for an appointment. Next day, parking at Tesco's, you nudge a woman's trolley and she falls over. Who's responsible for that? So is it your wife or your doctor, woman pushing the trolley, the policeman, or you? Okay, getting some votes coming in this time, which is great. Okay, I had a good lot of voting there, so I shall just end that and I'll share the results. So there you go, Dilwyn. It says 1% of people think it's the wife of the doctor. 1% says woman pushing the trolley. 0%, thank goodness they're not blaming the police, because that would have been me. And 98% say it's you, the driver. There you go. So
Great.
I shall hand over to Dilwyn. Thank you very much, Dilwyn.
Okay, thanks for running that one, Rob. And we will do that at the end, but it's looking good so far, I think. So I'll just share my screen now to get the presentation up. Okay, so hopefully you can see that now. And really at this point, well, thanks Rob for inviting me to talk. I'm really pleased because what I'm going to tell you about today is not something that's generally known very widely. In fact, it's something that we only found out literally 3 or 4 years ago. And it's a story that is developing, and there's still a long way to go. So hopefully what I'm going to tell you today is something that you won't have heard before, and so you'll get some new information, and so I'm very pleased to be able to do that. So we're going to pivot really away from eyesight to something else that can develop as a consequence or a complication of diabetes. And so I'm talking now about something that affects your legs and your feet. And this is termed diabetic peripheral neuropathy. Neuropathy means nerve damage. So I'm going to talk about driving with diabetic peripheral nerve damage, and some particular problems that we found, and some possible solutions to those problems that we're already working on. And this work was done in Manchester. So most of our participants who took part in the study I'm going to talk about came from around Manchester in the northwest region. So why is this important? Well, it's important because there are two growing challenges that we face in the UK. The first is that there are more older drivers. And that's a challenge because older drivers are at greater risk from a crash per driver or per mile driven. So if, as an older driver, you're involved in a crash, you're more likely to be injured than somebody who is younger. So there's a risk to older drivers, and there are more older drivers. Secondly, there are more people with diabetes. And if you think, well, how many people in the population have got that? It works out to be about 9% of adults. And that equates to about 3.8 million people. Now, there are two types of diabetes, and I'm going to talk today about type 2 diabetes, and 9 out of 10 people who've got diabetes will have type 2 diabetes. And that's something that tends to come on later in life. It's to do with some lifestyle factors. So if you are overweight, you're more likely to develop type 2 diabetes. And if you generally don't take much exercise. And it turns out that once you have type 2 diabetes and you've had it for some time, about half the people will go on to develop this complication that I'm going to talk about of nerve damage that's affecting your legs and your feet. So how many drivers does that equate to? Well, it's the number of drivers in the country times the prevalence, what percentage of people have got it, times the half who will go on to develop the neuropathy. And that turns out to be just over 2 million drivers. And as I say, because type 2 diabetes tends to develop later in life, of those 2 million, more of them will be older drivers and less of them will be younger. Although diabetes is starting to come in people younger and younger. And that's something else that is another reason why the pressure is likely to grow to sort out some help for people who are wanting to continue to drive safely with diabetic peripheral neuropathy in the coming years. So we think that these numbers that are increasing might lie behind the reason that if you look at the crash statistics affecting older drivers, those are tending to go up slowly, whereas if you look at younger drivers, the statistics are tending to go down, and in between, the statistics tend to be flat. So for some reason, we aren't reducing the number of crashes, which result in serious injury, in particular in older people. And I think that what I'm going to tell you about, talk about today, might be some of the explanation behind that. And my estimate is that if one person has a crash in which somebody is killed or seriously injured, out of every 1,000 drivers who have the nerve damage, then that would result in, from the 2 million drivers, 2,000 crashes per year in which someone was seriously injured. And that is quite a big proportion of all the older drivers who are killed or seriously injured in the year. So it could be quite significant in terms of the numbers. It could be making a significant contribution to those statistics, which we all want to see improve. So the question really is, could the increasing number of older drivers and the increasing prevalence of diabetes explain some of that rising trend? And this, I'm going to talk mainly about just the general public, so people who drive their car, not people who need to drive as part of their work, so heavy goods vehicles, vans, taxis, bus drivers. And if anything, the problem could be more pressing for them because they're probably driving more for long hours. They will have a fairly sedentary lifestyle. If you're sat in your lorry cab for 8 hours, you're more at risk of putting weight on. You're therefore more at risk of getting type 2 diabetes. And as I say, you're driving more miles. So it's probably even more pressing if you're somebody who does a lot of driving for your work and you're in your 50s or maybe your 60s. Or even older indeed. So what are the particular problems that we've identified for somebody who's driving with this nerve damage in their legs and their feet? Well, the problems arise from what those nerves are there for. So what do they normally do? Well, they normally do two things. They take messages from your feet and from your leg to the brain that tells it information that it wants to know to enable you to do things successfully. So some of that sensory information, we say, would be the sense of touch, so cutaneous sensation. So if somebody touched the underneath of your foot, would you be able to feel it? And another example would be, could you feel the pedal under your foot when your foot is resting on the accelerator pedal? And could you tell how hard you were pushing down on it? And that information would normally go from sensory receptors in the sole of your feet, and that gets affected. Those sensory nerves get affected. There's something that probably you're less familiar with. It's called proprioception. Now, this is the ability to know where the parts of your body are, including your foot. Now, I can close my eyes and I can do this sort of thing, move my fingers together, and if my hand is behind my head, I still know where it is. So I'm not depending on being able to see my hand or my foot to know where it is. How our brain knows that is this proprioception. So there are sensors, if you like, in your muscles that are constantly telling your brain how long each muscle is, and your brain can work out in real time, moment by moment, the end result of all those different lengths of your muscles. It can tell where your finger is in relation to another finger, and it can tell where your foot is. Now, that proprioceptive information is also affected. That's another sort of sensory information that starts to sort of degrade due to the nerve damage. And so that's fairly likely, we think, to affect your ability to judge the position of your foot and, in fact, how far you've pushed down the pedal. And the angle at your ankle. So as you move your foot and rotate at the ankle to push the pedal down, you're not quite so aware of exactly what your foot is doing and the position that it's in. Now, there are also motor nerves, which are nerves that take the commands from your brain spinal cord down to the muscles in your legs and feet that enable you to actually push down when you want to push down on those pedals. and that also gets affected. So, you know, maybe, so you're not quite as strong, and you may not be able to develop a push as quickly. So there's problems on the sensory side, on information going into your brain. There's problems on the movement side. Can you move as vigorously if you need to, maybe in an emergency stop situation? So any or all of these things, we figured before we'd done our experiments, might lead to difficulties in operating, for instance, the accelerator, but also the brake and the clutch. And that might then impair your ability to control the vehicle as you're driving along. So we did a study in which we looked at 3 groups of people. The green group are the people who have the nerve damage. So they've got diabetes and they have the nerve damage. And we compared them to 2 other groups of people, people who have diabetes but no nerve damage, and people who don't have diabetes. And so we've compared these 3 groups of people and their driving to see whether they all look the same or what differences there might be. And so people came into our lab and into our driving simulator. And first of all, we tested out what they could do. These are called motor function tests. So we tested the strength in the muscles of their right leg, which they would use normally to push down the accelerator or the brake. And we just tested how strong were they and how quickly could they develop a push down. And then we also did a measure of how aware were they of where their ankle position was, and whether they knew exactly what their foot was doing, essentially. So these are tests that you can have done and find out about how things are going in your leg. Now, there are some graphs, but hopefully the message from these graphs is very straightforward. So I'll explain it. And if you're interested, you can come back because this is being recorded. You can look at the graphs later on. But it's a fairly clear story. And so we've got 3 sets of graphs here. On the left, how quickly can you develop a force to push down? In the middle, what's your maximum force that you can push down? And on the right, how good is your proprioception, your sense of knowing where your foot is and what it's doing? And again, we've got the people with the nerve damage are in green. If you look at the left-hand side, the speed of strength generation, the green column is lower. So they can't push down as quickly. If you look at the middle 3 graphs, again, the green column is lower. So they're not as strong, can't develop as much force. And on the right-hand side, the green column there is higher. So with the nerve damage, the error in knowing the angle at your ankle and therefore what you're doing with your foot is greater. So you're not as good at knowing the position of your foot on the pedal. Now, this is a sort of a summary diagram and a list which just says everything that we could measure. Basically, we had people come into our driving simulator and we measured everything we could. Everything that we thought would be interesting in terms of how the person was driving. So we looked at their use of the accelerator. We measured where they were looking through the car windscreen effectively. We measured what they were doing in terms of steering, so how the steering wheel was moving. We looked at the relationship between where they were looking and how they were steering. We looked at their overall speed, and we also noted down if the person ever lost control as they were trying to drive. And we got people to drive the same route over and over as if you were doing your daily commute. And everybody drove the same road at least twice. So these graphs show driving speed. So the first drive is in black and the second drive is in white. And basically for all 3 groups of people, the white column is slightly higher than the black column. So the second time they drove this route, because they knew it a little bit better, people tended to drive a little bit more quickly. But they're actually driving well below the 30-mile-an-hour speed limit, somewhere between 20 and 30 miles an hour. And basically, the drivers with nerve damage on the right-hand side, you can see their columns are lower down. So they were driving more slowly. Now, in principle, you might say that's actually a good thing. because if you're driving more slowly and you do have a crash, then you're going to be injured less severely. So perhaps nothing wrong with driving a bit more slowly, as long as you're not driving so slowly that people behind you start to get frustrated, which could cause its own sorts of problems. So people with the nerve damage tended to drive a bit more slowly. And we think that was compensating for some of the problems that they're experiencing as they drove. Now, these two pictures are really the key part of the presentation, and they are really pictorial representations of driving on the left-hand side by healthy individuals and on the right-hand side by people with the nerve damage. Now, you can think of this as a sort of a city skyline, if you like. And the key thing is that these two graphs have got different shapes. So the one on the left, there is a very high peak towards the left-hand side, and then that comes back down, and then there's a sort of a lower peak in the middle, and then that tails off. And so that's the high peak. Then there's this middle hump here, and then nothing much out here. Compared to the one on the right, again, you've got the high peak, but now you haven't got that hump in this range here, whereas it was there here in the other drivers. And then you've got this little bump here, which doesn't look terribly ominous, but in fact, that's a big part of the problem. Well, what are these plots actually showing? Well, they're showing across on the x-axis, you can see it's labeled in degrees. And so at the left-hand side, we've got 0 degrees. That's when the pedal, the accelerator pedal, is not pushed down at all. And then as you go across to the right, the pedal is pushed down more and more. And the furthest they can push it, so that's the pedal to the metal, all the way down to 20 degrees. And so with people who don't have any nerve damage, you can see this hump in what was really the mid-range of the pedal. And so a lot of the time when you're driving, these graphs show the percentage of time in that whole journey, how much was the accelerator pedal down by different amounts? How much was it 1 degree down? How much was it 2 degrees down? 3, 4, 5, and so on. And what you can see is that in both graphs, a lot of the time when you're driving, you're actually got a very, the pedal isn't gone down very far at all, less than 2 degrees. And that means you're either sort of coasting or accelerating very gradually. And then in the mid-range between 2 and about 8 degrees, that's the range where you would produce a sort of a graded acceleration, which was appropriate to the situation as you're driving along, a sort of skilled, carefully adjusted type of acceleration. But then if you go further out to the right, you're getting more and more powerful accelerations. And so the people with nerve damage we saw were doing less of the mid-range acceleration. There really isn't much of that going on at all. And they were doing a bit more out here, out to the right. So more of the time, they had the pedal pushed down further. And that is the basic difference that we found out, in the basic difference in the way they were using the accelerator pedal. They spent less of the time using the middle of the range and more of the time at the extremes, either coasting or accelerating in a way that we would call it an aggressive acceleration if it was in a healthy driver. And they were probably not really aware that they were doing this. Now, we can do lots of analysis in the lab, and I'm going to go fairly swiftly over this next one. We could compare those 3 groups of drivers, those 3 profiles in the way they use the accelerator, and we could say, okay, let's compare the drivers with nerve damage versus the other 2 groups who don't have the nerve damage, and we could just look at the difference between them. And so we could generate all these different graphs, and basically what we found out is that you can see this little dip down here. This is a difference graph, and this dip here simply is a way of showing what I already said to you, which is that if you have the nerve damage, you spend less of your time accelerating in the mid-range of the accelerator pedal. And that is the key thing that we found. So it's, if you like, it's a bit of a change in driving style. And the consequences of that are shown in this graph. So again, people with nerve damage are shown in green, and the other two groups in orange and blue, and neither of those groups had any nerve damage. And whenever a person lost control, by that what we mean is that they went out of lane. So they either crossed the central white line, or they went up onto the pavement or the grass verge. They basically went out of lane. Sometimes they could recover it. Sometimes they would actually hit something. Basically, every time that happened, we counted up for how many seconds were they not in control of the vehicle. And that is shown in the axis. And the first time drivers with nerve damage drove this route, in total, we found that there was 60 seconds of about 15 minutes of driving where we could see that they were not completely in control of the vehicle in the way that would mean that they were a safe driver. Now, the encouraging thing on these graphs is shown on the right hand side, and basically if you look at drive 2 here and this green column here, you see it's much lower and much shorter than this one here. So what that means is that by the time they drove the route the second time, so effectively they'd had one practice drive and they knew the road a bit, by the second time the amount of time that they were not fully in control of the vehicle had dropped to about 10 seconds. So they'd improved a great deal by driving a route that they were familiar with. And we thought that that spontaneous improvement between the first and the second drive was something that was encouraging, that it's not just you've got a problem and there's nothing you can do about it, but actually that you do have a problem, but that you can see that in circumstances such as driving a road you know well, that problem could almost completely go away. And so one of the things that we're going to be looking at in future is to see whether we can actually help people by giving deliberate coaching to make that improvement even bigger. And that's one of the things that we're going to be pursuing in future. So that's just a trace that showed what we see when somebody loses control is they go out of lane, they start to swing the wheel in quite large amounts, backwards and forwards, to get back in lane. And that's not the sort of driving that we ideally want to see. So these are some traces, and these are again pictures, if you like, of driving. And the orange trace, essentially, it's more or less flat with small wobbles up and down. This is the movement of the steering wheel. So up and down means left and right. Above that, you can see there are some blue blocks of color. And as the blue comes lower down, that is the movement of the accelerator pedal. And you can see that it's more or less at the top of the picture. This is good driving. But we compared that with the odd occasion where we saw what looked like a mistake. So this is not now a change in driving style. This is an actual mistake where we think the person intended to brake, and we know that they needed to brake because they were approaching a sharp bend in the road, but actually they hit the accelerator. And so this is good driving, and this is a picture of what happened under one of those situations. Now you can see there's this big blue spike going right the way down the picture, and then the orange line meanders off and goes down to the bottom. Basically, the steering wheel has gone fully to full lock towards the left, as the person had drifted out onto the right hand side of the road and had to bring the car back, and they had to use the full lock of the steering wheel to do that. And they did recover, and you can see that the line comes back up to the middle. There's another example I'll show you. And on this one, the accelerator pedal was repeatedly pushed down a long way. And you can see that these large swings of the steering wheel are making the orange trace go up and down a lot. And this person did, again, recover and come back in lane. So now we're talking about something that we call pedal errors or unintended accelerations. So in a situation in which you need to brake suddenly, perhaps, you forget to move your foot across and you push down as fast and as hard as you can on the accelerator, which of course does the absolute opposite of what you need in that situation, and you're going to accelerate very powerfully. So just to conclude, really, the problem sort of list, if you like, if you are driving with nerve damage that is affecting your leg and your feet, you're going to have a reduced sense of what the angle is at your ankle and what your foot is doing on the accelerator. You're going to have some impaired muscle function as well, but we tend to find that that probably isn't the limiting problem. You're still strong enough to actually push down where you need. But we found that the use of the accelerator was less well controlled, involving more time spent with it in the extreme high and low positions, either coasting or accelerating quite vigorously. Despite driving more slowly, people who have the neuropathy nevertheless experience more loss of control than the other drivers who didn't have any nerve damage. And that's, if you like, the list of problems. Now, there is one positive thing that I've already mentioned, which is that the improvement between the first drive along a route and the second time you drove that same route indicates that there's quite a large potential actually for training and familiarization with routes to improve the driving, improve the pedal control, and so improve your driving. So really, I'm going to move on now to some possible solutions. And one thing that we're going to try and do is based in a clinic, so it might be a diabetes clinic. One of the things that several speakers mentioned earlier on is that you're not terribly good at picking up changes that develop slowly, so changes in your eyesight that develop slowly. And it is exactly the same with this peripheral nerve damage. It tends to come on over years. And firstly, you may not be aware of it. And you may not be aware that your driving is changing as a consequence. Other people in the car might notice things before you do. Now, if you're not aware of it and nobody else has spotted it yet, you're not going to go to the doctor and say, I've got this problem. So the first thing we think we can do is to make sure that people who have nerve damage that's affecting their driving are diagnosed, so that they know that they have got something that needs to be addressed. So we think that the sort of analysis that I showed you actually tells us, whether you know or not, tells us that you are using the accelerator pedal differently. So that's a sort of diagnosis of a problem. So if we then tell the person, you know, exactly what is it about your driving? We've noticed this, that you tend to be sometimes a little bit heavy on the pedal, and that we need to train you back out of that so that you drive more like you drove before you had the nerve damage. And that training is something that we could deliver in a driving simulator, and hopefully see improvement. And maybe the same technique we use in the driving simulator would also work in a car on the road. So that's things that we can do in the clinic, where you come along and we sort of give you some help. Now, already, I'm sure at many points this week, you've heard about these driver assistance systems. So cars are getting more and more complicated, which isn't always a good thing. But the basic aim of the manufacturers is to put features in the vehicle that will help you to drive, to be safer when you're driving. And so these are based on computer programs or algorithms, and they are automatic, and they are meant to help you. So automated driver assistance systems. And we think that you might have a system which would enable you to overcome the effects of your nerve damage and drive more like a driver who doesn't have that. So that even if you yourself would make mistakes or be driving differently, the assistive system could help to oppose that and help you to drive more like you used to. And if the worst was about to happen, that it would be able to intervene and reduce the risk of completely losing control to the point where you're at high risk of having a crash. And just to tell you a little bit more about these driving assistance systems, we're basically just talking about something that is, it's an algorithm, it's a program, a computer program. Your car contains lots and lots of computers, and so it's in the car, it's working away for you without you knowing. It's crunching some numbers, it's looking at use of the accelerator, and then it's got a logical function. It can take a decision. And the decision it can take is this: if the current speed of the vehicle is 38 miles per hour and the speed limit is 30 miles per hour, then you're going too fast. And the system might intervene to reduce the speed of the vehicle to the speed limit. If, however, your current speed is 38 miles per hour, so you're doing the same speed again, but the speed limit is actually 40, then nothing needs to be done. You're legally below the speed limit. So this is intelligent speed assistance, really. So the car knows from GPS the speed limit of the road that you're driving on, and knowing that, and knowing the current speed of the vehicle, it knows whether you're over or under the speed limit, and it can intervene to make sure that if you're about to go over the speed limit, it warns you, you feel the pedal not wanting to go down, you feel a resistance, and it can do a flashing sign saying speed limit approached or something like that. So intelligent speed assistance, that already exists. If you buy a new vehicle now or bought one very recently, you may well have this. I think more and more cars are going to have this in them, and that you can see could help limit your speed if, for instance, you mistakenly push the accelerator down when you meant to brake. So it could stop you under those circumstances in going very high speed. It wouldn't allow you to go faster than the speed limit. And so we think that you could have something in your car that would be crunching the numbers for you as to how are you using the accelerator pedal, and the car would know whether you're using it as if you didn't have any nerve damage, or you're using it in this impaired way. And again, if it finds that there's some problem and that there's some critical value that's exceeded, maybe you're accelerating too aggressively, so you've gone more than halfway down, or you're all the way down to the floor, then it could provide a warning feedback and perhaps intervene. And if you weren't doing anything differently, then it wouldn't need to take any action. And you can think of more and more complicated things which would intervene in different, more and more subtle ways, again, only when you need it. So you wouldn't be aware of them when you're driving along normally, but if you are about to get into a difficult situation, hopefully it would help you out. So, as I say, some of these devices already exist to protect road users, both you in the vehicle and people who are around it. And intelligent speed assistance is one such thing. So I'm interested in knowing, is there something that would enable a driver with nerve damage to drive as if they didn't have any nerve damage, and so protect them from any of the consequences of a condition, either a pedal error, accelerating when you need to brake, or just a change in driving style, using more aggressive acceleration, but probably you don't really intend to. And I'm aware of at least one system, and there are probably many more, which can be retrofitted into vehicles. It tends to be sold to fleets, so this is made by a company called Sturdy, and it's the vehicle management system. And what does that do? Well, this is a computer effectively that it's, as you're driving, it knows the speed limit through GPS on the road that you're driving on. It's also connected to the accelerator. So it knows the current speed of the vehicle, the position of the accelerator pedal, which effectively is the acceleration that you're requesting at that moment. And what does it do with all that information? The output from this computation is that it allows through only an appropriate proportion of the requested acceleration, so as to prevent both aggressive acceleration and breaking the speed limit. So let's say you're setting off from a traffic light that's just gone green and you're on a road where the speed limit is 30, then you might want to accelerate away quite briskly, and that will be allowed. But as you get closer and closer to 30 miles an hour, if you keep your foot a long way down the accelerator, this will start to intervene and scale back the actual acceleration that the car will produce. And I was demonstrating this in, I think it was a Volvo XC60 or XC40, where initially the person floored the accelerator, and that car, which was quite powerful, leapt forwards really. And this is in a very large parking lot, and accelerated very powerfully. And then they did it again, did exactly the same, floored the accelerator with the gadget engaged, and it was as if I was the Queen being driven by a chauffeur. It was a perfect pull away, perfectly gentle. And so clearly this could help stop you from making those sort of powerful accelerations that very often will not actually be appropriate or helpful. So I think we've got two ways to summarize to protect drivers with nerve damage from the altered driving style involving aggressive acceleration and occasional inadvertent mistakes where they don't intend to, but do accelerate, these pedal errors. So I would say there's a couple of things. Ideally, you could drive a car fitted with one of these systems that would prevent you from accelerating aggressively and breaking the speed limit. Now, another thing that I'm in favour of, and I dare say Rob will have an opinion on this, is that from my point of view, it seems good to drive a manual stick shift vehicle. So changing gears manually. So you have to change the gears rather than an automatic. And the reason I think that is a good thing is that if you're in a stick shift vehicle where you change the gear, that imposes a limit of the maximum speed achievable in the gear that you've selected, rather than the maximum speed the vehicle can reach if you floor the accelerator. So if you're in second and you go all the way down with the accelerator, you're probably still only going to get up to between 15 and 20 miles an hour. Whereas if you're in an automatic vehicle and you floor the accelerator, it will interpret that as a request for maximum acceleration. It will kick down a gear maybe, and then it will take you up through the gears all the way to the top speed of the vehicle, which might well be 80, 90 miles an hour. So in my view, having a manual stick shift vehicle gives you an added layer of protection that if you are going to hit something, better to hit it at a lower speed than at a higher speed, because the damage done tends to go up as the square of the speed. So if you're going at 30 miles an hour compared to 60 miles an hour, it's not just twice as bad at 60 miles an hour, it's 4 times as bad in terms of the damage that is done. And the good news is that intelligent speed assistance and these other systems exist. And of course, stick shift vehicles already exist. And I would say, think very hard about if you're thinking about switching to an automatic vehicle, I would think very hard about that, because although they're easier to drive in one sense, you're removing a layer of protection, which I think the more protection you have when you're driving, the better for everybody. Now, I believe that is the end of the talk, so I'll stop sharing at that point.
Well, that's been wonderful. Thank you ever so much, Dilwyn. An absolutely really useful input there. And I just appreciate you spending your time putting that all together for us. Yes, the question you just posed me at the end there, I totally agree. Actually, one of the things we advise for older drivers is if you're driving a manual car, continue driving it as long as you can, really, because what we do find is people who swap to an automatic aren't used to it. And apart from this feeling in the pedal and things like that, and keeping to the right speed, there is the thing that sometimes people can get confused on the pedals and have pedal confusion issues as well. The other thing is very good about what Dilwyn says about manual cars, and something I know, I work as a speed awareness trainer as well for people who unfortunately get caught for speeding. And one of the things we train there is that, you know, if you're in a 30 mile per hour limit, stick to third gear, because what that actually does is always making you keeping that bit. 40 miles an hour, fourth gear. 50 miles an hour, fifth gear, because your speeds pretty much will match that. And most modern day cars will keep you in those ranges so that you know that you're not likely to speed or exceed the speed limit. Now, I agreed I'd do those polls. Thank you ever so much for everybody who came back to me and said, yes, we wanted to vote, but we couldn't. Yes, it's my fault. I apologize for that. I'm going to try and share it again. What happened is I had a bit of a technical problem my end. I shall try and relaunch the poll to you. Right, you should be able to vote now. Do you have diabetes? Yes or no? Thank you, everybody. You're voting this time, which is fantastic. My fault completely. So I'll leave it a little bit more for you to have a go on that. A little bit more. Okay, I think we've got everybody who's going to vote in there. So as you can see, it says yes, 20% of people have got diabetes, 80% have not. But as we know in the world, unfortunately, it's something which is a growing thing that's happening. So it's really useful for us all to be aware of it. And it's great that we've got 20% of the people aware of it. What I said I'd do is I would share the other poll again with you. So I'm just going to relaunch that again. Okay, so we're just going to go about that same question again to see if your answers have changed since last time. Your wife says you're heavy on the pedal. You don't even feel a stone in your shoe. Your doctor says some numbness. I'll contact the diabetes clinic for an appointment. Next day, parking at Tesco's, you nudge a woman's trolley and she falls over. Who's responsible? Okay, well, we're really almost having a categorical answer here, I have to say. Here we go. 100% this time. Say it's my fault. And I'm afraid it is. You're the one in control of the car. It's down to you at the end of the day. It's completely down to you. So we'll invite Henry to join us back. And then we've got loads of questions that have come in. So welcome back, Henry. Right. Just going to pull up a load of questions we've got. So I'll probably start a bit with you, Henry. Okay, let's have a look. What are your thoughts on the use of yellow tinted polarized lenses when driving at night?
Yeah, so these are quite widely advertised and sometimes for night driving as well. You've got to be a little bit careful because the guidance says you shouldn't have more than a 25% tint if you're driving at twilight or night. And a lot of the ones that are marketed exceed that and wouldn't be legal for night or twilight driving. So generally speaking, we would advise no tint for driving, although sunglasses when it's very bright can be helpful. I use photochromic lenses, the ones that go dark in the sun, but they don't work behind most car windscreens because the windscreen itself blocks out the ultraviolet light that activates them. So they give you a slight residual tint, a very light tint, but they don't go dark in the same way they do walking around outside in direct sunlight.
That's great. And I know really from my point of view, being an ex-police officer and traffic officer, one of the things we found is that when you wear those yellow tinted glasses at night, yes, sometimes it makes things somewhat clearer in brightening in bits, but the problem it does do is like you come up to a set of traffic lights, all the colors look pretty much the same and therefore dulls the red, the green and the amber as well. So sometimes we've had confusion to where people can't remember where the light was and actually have broken the law by going for a red light or something. So something to think about, certainly there. Right. Let's just have a look at this may be one. If you have to start wearing glasses, is this a notifiable condition to the DVLA?
Oh, that is a really good question. It's something that you're supposed to say when you apply for your license. I don't know if there's any actual requirement to notify the DVLA if you become reliant on glasses. It's not something that most opticians would tell people to do, but that's a really good question. I don't know the answer.
I can probably answer it for you, to be honest.
Thank you.
It's not a legal requirement to inform that you wear glasses. This is a really weird thing. Obviously, if, for example, you require glasses or contact lenses to drive, you do have, when you apply for your license or renew your license, they will ask you and they will endorse your driving license with a code to say you require these when driving. The funny thing is that the only time it's one of those weird things. Apparently, it's the only time you have to tell the DVLA if it's some other thing rather than just corrected vision. And the really strange thing as well is apparently that if you, for example, then go away and get laser surgery, okay, and no longer have to wear glasses, you don't have to tell the DVLA that you've had that laser surgery done, even though you may have that little thing on your license saying it, which could cause you a lot of issues if you get stopped by the police. And I always recommend people to notify the DVLA, but unfortunately, they don't always remove that code off your license. So it's always useful to have something to say, honestly, I've had laser surgery, maybe a little slip with you, keep something in your pocket to say, I've had laser surgery, I don't need them anymore. Just something to bear in mind anyway.
That's a really interesting point, Robin. I suppose the same thing applies if you have a cataract done. Sometimes you don't need glasses afterwards, and your license may say that you do. That could cause a lot of confusion.
Yes, I think that's the problem. So actually mention cataracts. We've got a question here. I'm on a waiting list for cataract surgery, but the DVLA test is likely to come before the operation. Can I postpone the test until after the operation? Is this something you would be aware of or not?
Well, if by DVLA test you mean just a sight test with an optician, I wouldn't recommend postponing it. I think it's still important to go along and see what level of vision you've got. Quite often with cataracts, for example, you can get more short-sighted. So even if with your current glasses you're below the standard, it may be that the optician can update your glasses to bring you back within the right standard. So I wouldn't recommend postponing it. I'd recommend keeping that. There is a chance that if the cataract's progressed and you can't correct it with glasses, then you will be below the standard and you'll have to stop driving, unfortunately. But I certainly wouldn't recommend putting it off. I think you need to know about that.
Yeah, and regular eyesight tests, as you mentioned earlier, Henry, are such a vital thing. Not only we need our eyes to be able to see the road and the hazards ahead, but the really important thing is that it also can pick up many other medical conditions you weren't aware of at an early stage, which are then treatable. So invaluable thing to have done. Right, let's have a look. There's another one. There's no mention yet of monocular vision. Is there any advice on this?
Yes, so you don't need to have two eyes to hold a Group 1 driving license. So if you're a car driver or motorcyclist, you can usually rely on one eye as long as that eye is good and meets the right standards. It's a little bit different for Group 2 bus and lorry drivers, but for Group 1 drivers, that's not usually a problem.
Yes.
If you become monocular, that might be a problem. So if you're used to having two eyes and then you're suddenly relying on one, that can take a bit of getting used to. So it's important to allow time to adapt to that. But if you've been monocular for a long time, then usually you'll be quite well adapted.
And actually, that's led me to another question that we've come to, Henry, which is not really, well, I don't know. Often opticians do hearing tests as well in their sort of work. They have that going on in the same places. Somebody said to me, do I have to tell the DVLA, or what about if I'm deaf or lack of hearing? Well, the DVLA say you don't actually have to inform someone if you're deaf. That's only if you're driving a car or a motorcycle. But if you are going to be using something like a bus or lorry, it's one of those notifiable conditions you need to inform the DVLA. So do you cover hearing tests in your practice?
No, I know a lot of opticians do now have hearing specialist audiologists that come in, but no, not in the practice that I work in.
Okay, let's have a look. Okay, glare. I know we touched on this in your presentation, and I know there's often a point as we get older, sometimes glare can affect us much more than when we were younger. Is there anything we can really do to try and reduce that, especially because we know a lot of older drivers avoid driving at night because of it?
Yeah, glare is a really big issue, particularly caused with cataracts and corneal problems. The best advice really is just to try and keep every surface between your eye and oncoming headlights as clear as possible. It tends to be headlights is the main issue. So that means keeping the windscreen as clear as possible, keeping your glasses clean, all those sorts of things. But yes, glare certainly is a big problem with night driving, or particularly twilight, winter sun low in the sky.
Yes, certainly. And unfortunately, I dealt with a number of collisions, certainly where people have suddenly been blinded as they come out of a shaded area into a bright area. And certainly as we get older, it takes a little time to react, our eyes get back to normal, which I think is the rods and cones, if I'm right in saying. I may be jumping ahead in my expertise here, but rods and cones slow down in processing information as we get older. Would that be right?
Yeah, and I suppose the other thing to say is, of course, the visor in the car is useful to have that down, but it doesn't always help if you're a bit short like me, or if the winter sun is too low in the sky, it doesn't always work.
No, I know one fact I had, which was interesting, because a lot of people said, oh, I don't like driving at night, not sure why. And the fact I found out once before is at the age of 15, if we're blinded by a set of headlights, and we know these LED ones now are much brighter, it can take up to 2 seconds for a 15-year-old for their eyes to come back to normal. But this research has shown that at the age of 65, that can take up to 9 seconds for it to come back to normal. So it's really a real understanding as we get older why we find it more difficult about driving at night. Yeah. Okay, let's have a look at some more on these. So we touched, and I am a great supporter of what you're doing, Henry, nationally. You know my feelings on eyesight testing and wanting it to be compulsory. Unfortunately, what do you think of the current 20-meter number plate test? Do you think it's really fit for purpose?
I don't think it's a detailed enough assessment, really, and it's only taking place at one point in time. That's the main issue, that you can have that done at the age of 17 and then nothing else. But also, we would like the government to change the law and introduce a formal test that is a bit more fit for purpose, that maybe looks at peripheral vision, contrast sensitivity, not just visual acuity, takes into account more things than just that narrow assessment.
Yeah, I totally agree. And in fact, I sit on the National Older Drivers Task Force, and we have a new report coming out in October with some recommendations, and one of them will be on eyesight. Really, we're really encouraging that, you know, as you mentioned, we are one of the worst countries in Europe for our tests. The 20-meter number plate test was a bit of a sort of stick my finger in the air. Yeah, I think that's about the right thing that we should use, and very antiquated, really. And like you say, you know, peripheral vision and contrast sensitivity are such an important thing for driving. I mean, we need to be able to see hazards. The most injury incidents that happen with older drivers is at give way junctions, turning right across traffic. Now, some of that I'm pretty sure is due to reduction in your peripheral view. When you're looking left, you're not quite seeing those hazards come into your side. So it's really important to go and get those, your sight checked, making sure, because as Henry said in his presentation, those things can creep up on you without you being aware of them. Right, let's have a look at some more questions. At a recent normal eye test, the optometrist said there was nothing that he could do for one eye, which is slightly blurred, but didn't prescribe for the other. What should I do next?
Well, I think the first thing to do is probably go back to the optometrist and just find out why they couldn't improve the vision in that eye. And in fact, if you're concerned specifically about driving, it would be worth asking them, you know, what are your views on driving? Am I safe to drive? But I think the first step is to find out what they found in the eye and why they can't do anything about it. It could be a condition that's untreatable, like certain types of dry macular degeneration, for example. Obviously, I have no idea what the optometrist found, but that's one condition that's very common and not easy to treat. Or it could be, for example, some types of cataract in particular areas. If it's not affecting your vision sufficiently to meet a criteria, even though you could have it removed, they wouldn't necessarily offer it on the NHS. So there may be a local criteria that you don't quite meet. So I think it's important to just have that discussion again with your own optometrist. Yeah,
very good point. And obviously, I like my neighbor just recently, they've just had a cataract operation, and unbelievable difference. They weren't aware of how bad their eyes had deteriorated until they had the cataract operation. Someone asked us, once you've had that done, do these lenses deteriorate over a period of time?
Not usually. The only thing that sometimes happens is the back surface of the lens can cloud over. We call that posterior capsular opacification. And it feels almost like the cataract coming back in some cases. It's the same sort of sensation, misty vision. But the good news is that it's pretty easy to rectify. You go back to the ophthalmologist, the eye doctor will laser the back of the lens to clear that up. And once it's been done, that's it. It's just one-off treatment and it won't come back again.
And it's becoming a more popular and a much safer treatment these days. It's something, would you recommend it if people have got it?
Yeah, I mean, cataract itself is almost considered a routine thing these days. You go in the hospital in the morning, home by lunchtime. Very, very few complications, very quick surgery, and almost everyone is delighted with the results. And likewise, if you do get that complication afterwards where it gradually clouds over a few years later, then you can have it lasered, and that's also very quick, in and out, same day, home for dinner. That's wonderful news.
Right, Dilwyn, we've got a few questions for you as well. So Dilwyn, obviously you've spoken to us about the wonderful study you've done about this experience and training that helps with people. And it really does seem that deliberate coaching is the way that we should go forwards, really, in taking that forward. It's something which hopefully will get out there. And someone's saying, it seems to be the more experience you have, the better you'll be driving. Would that be right?
Yes, I mean, so we haven't got an awful lot of information on it yet, but as I say, that the first thing we spotted was that just driving a route that you've driven before, you're a lot better. So if you're driving around, near where you live, you're fairly likely to know the area well and to driven those roads, and so we would predict that under those conditions you would be a lot better. And I think it's often the case that if it's when you're in an unusual situation, particularly if something develops suddenly, that you're pushed closer to your limits that you may not have been aware of at all, in a situation which, as I say, is very familiar. And so, definitely, it's going to be I think the worst possible situation will be you're driving somewhere you've never been before. maybe it's a city centre. In addition to just navigating the road and staying safely in lane, you're also trying to look at road signs. You're trying to get somewhere, you don't know how to get there, or and there's lots of traffic around you, and other people might be doing unexpected things. So you've got to be thinking about that as well. And so the sort of the burden, sort of the cognitive load on you there is a lot higher than if you're just driving along a road you've known previously, nobody else around, and yeah, you're likely to have a problem in the complicated situation, particularly if things change quickly, and particularly if there are lots of things that are actually outside your control.
Right. With diabetes, do you know, is this something that we need to notify the DVLA about?
The neuropathy, I believe you do have to notify DVLA if you're diagnosed with neuropathy. Now, one of the problems is, as I say, because it comes on gradually, I think that at any one moment in time, there are likely to be quite a few people driving on the roads at increased risk, and they don't realize it because they themselves haven't noticed, nobody else has noticed, so they haven't gone to their doctor, and the doctor, or even if they have got that far and they've gone to the doctor, there may be then a delay from when they can go and be assessed at the diabetes clinic. And so you can imagine that before you actually know for certain you've got the problem, you are driving in a way that is to some extent affected, and that is putting you at a higher risk. And because you're not aware, you're not going to do anything about it. So you're not going to be driving more carefully because you know you might have a problem. So yeah, there are problems in terms of, that's why I think one of the important things is that people do have a diagnosis as quickly as possible and as accurately as possible, so that if things are changing, you know as soon as possible. And the earlier you catch things, I mean, that's been said many times, that the more likely you are to be able to overcome the developing consequences as regards to driving.
That's great. And we talked about notifying. Now, I know yesterday we had a webinar on notifiable medical conditions. So that was really an important one. And actually, for anybody wanting to know, we've spoken about sight, we've spoken about diabetes and various different things. If you want to know what conditions are notifiable and when in that condition they're notifiable to DVLA, if you go to our website, olderdriversforum.com, there's a page called Advice. Drop onto that, and then you'll see a list of things called medical conditions. Click on that, and that will take you to the government page on the A to Z of the 183 notifiable medical conditions. And I know with diabetes that it's notifiable if it's insulin dependent, but if you're not insulin dependent, I believe it's not notifiable, unless obviously there are other complications going on. Right. Another question here, this is quite an interesting, what treatment is available for nerve damage? Is there anything else? I know we've training, but is there knowledge you've got that treatment that people can have otherwise, rather than just retraining?
Okay, so as far as I'm aware, there is no treatment that can reverse the nerve damage. So to actually get things to improve that way. However, as I say, it's a condition that progresses and develops gradually over time. So even if you can't reverse it, if you can at least halt or slow down the progress, that's definitely worth doing. And there, essentially what you're trying to do is you're trying to slow the progression of the diabetes. And there are things you can do there. So essentially having an active lifestyle and trying to perhaps lose a bit of weight. And I think the amounts you need to lose can be quite small, but actually will take you back from having diabetes. So it won't repair the damage that's already been done, but you can go into remission. So you can, for instance, I'm aware that people through either limited calorie diet, so you're not taking as much energy in, or through specifically limiting your refined sugar intake, things that would spike your blood sugar levels. Basically, by modifying your diet, so you're eating better or eating less, you can go from being on quite high levels of insulin dose to a lower or even no insulin. I know there are clinicians who've seen that. So, no, you can't. I don't think there's any evidence that you can repair the nerve damage at this point, but you can perhaps stop it from getting worse by intervention, by sort of lifestyle changes that I wouldn't say they're easy, but it's something that you can try, and some people do manage that.
Yeah, and I think that's an important thing for all of us, really, isn't it, that we do that. So my other half just bought himself a pair of Birkenstock shoes for the comfortable footbed for driving. I'm a bit concerned that the soles are so thick and inflexible that he will not be able to feel the pedals correctly. He is 70 and has diabetes and needs glasses. I prefer a soft, thin soles for driving. Are there any recommendations to say about this?
Well, I believe people who race cars, so Formula One racing drivers, they have special footwear, and I believe it's very thin soled. And I think that probably is so that they can get the maximum feel of what they're doing with the pedal. And yeah, you can imagine that if you've got a very thick sole and very spongy, it would be more difficult for you to know exactly what the pedal was doing as your foot was pushing down on it, because some of that would be absorbed by the cushioning in the sole. So I don't know if full studies have been done, but I think that's interesting that, as I say, people who race professionally and are doing that to the very peak of their performance tend to have thin-soled driving shoes. And I guess so it might be worth having a thinner-soled pair of driving shoes, and then the other shoes for when you get out and walk around and you walk around town or whatever.
Yeah. That
so
sounds
what do you think about that, Rob? I mean, that
sounds a sensible idea. And I certainly, when I did my advanced driving course for the police, that's it. We used to, you often see policemen wearing these big, thick shoes, you know, with protected toe caps and things like that. When the first time we go with the driving instructor, he says, you want to chuck those away for the course, put on a pair of thin shoes so you can feel the pedals and feel that, so to make that smoothness, because otherwise you just, and I felt it was just like a real clunky feeling on the pedal. I was either on, off, had no real clutch agreement with it at all. Now, obviously, unfortunately, the world is changing a lot. We're moving forwards to, I wouldn't say unfortunately, it's maybe a good thing to move to electric vehicles, but nearly all electric vehicles are going to be automatic. And often we have that feeling where we have a less of sensitivity maybe on that. I mean, I think there's the developments, I certainly know, Derwin, in Japan, aren't there? They've done a lot with the cars there. Like you mentioned, the sensitivity around that, they will stop the sudden acceleration when people do those sort of things. But I mean, certainly I wonder whether we're suggesting stay to a manual, but people are in the future going to be pushed to an automatic car, certainly with the electric cars. And some electric cars are single pedal as well. So they work as an accelerator on, and as soon as you start taking your foot off, they start braking. I think that's a lot to get used to, really, for us into the future. But I think any comments on that at all?
Well, I suppose, so it depends what your current situation is. If you've got a manual at the moment and you are thinking of changing to an automatic, I would say, well, I would be tempted to say stay with a manual if you can. So that's the first thing. Now, if you've got a new car and it is an automatic, then one of the things you could do is make sure you've got the intelligent speed assistance turned on. Because again, the aim is to stop you from hitting something at the top speed of the vehicle because of some mistake that you've made. So I think being restricted to the speed limit of the road, that's a really good thing. So the same cars that might be, because they're new, that might be more likely to be automatic or electric, at least make sure you've got they should also have the intelligent speed assistance, have that turned on, I think, is one thing there. But I think it just means that, that's another challenge. And there are good reasons for going to electric vehicles in terms of the global warming and things like that. But yeah, it's not an easy switch, I think. So I guess another thing is, if you do switch from driving manual, and you've done that maybe all your life, and you do switch to an automatic vehicle, you probably need to maybe go and have a few lessons with somebody.
Yes. That's the thing that we would always recommend. Anybody moving from manual automatic, don't just take on an automatic and drive out the showroom with it. You need to go and get lessons with it.
Yeah.
If people are interested in the electric vehicles, we had a wonderful talk on Tuesday all about electric vehicles and the automated adaptions that are fitted to vehicles. Really useful if you're thinking, which is at some point, I think we're all going to have to be moving to electric vehicles. It's a very, very interesting talk, not only for older drivers, but for all drivers. So I'd have a look at that. Another question for you, Dilwyn. For those with peripheral neuropathy, what is the opinion on using cruise control?
I don't know.
I suppose at the end of the day, it's stopping you you can take your foot off the pedals completely, aren't you? So that's what they're trying to engage with, I suppose. But I think what it is, you still will have to engage with the pedals at some point. So it may help for just setting your speed so you don't have to keep going up and down on the pedal. I'm guessing what they're getting at.
Yeah, I suppose it reduces the thinking load on you. I mean, I think the thing with these things is if there's the transition between having a system partly drive for you and then you taking over driving it. I think there are things that people have started to become aware of. That for a few moments as you make that transition, things aren't. You're not quite so much in control as you would be if you were just driving all the time. I'm a bit wary. I mean, I've got cruise control on my car, but I don't actually use it. But I am aware that means I have to put more thinking into staying below the speed limit, which of course it would take that away from you. But yeah, I feel happier the more I'm actually in control.
I tend to use it a lot when I'm going into roadworks where they've got the set 50s and things like that. I try to put it on there really if I can. Right, back to you, Henry, a question. Is there any problems driving with dry eyes, and what treatment or products would help, if any?
Yeah, so you can get problems with dry eyes, I suppose partly because you're needing to blink more often. Also, if there's air conditioning in the car, or if you've got your window open on the driver's side, then that makes the eye a bit more dry. We used to see it a lot actually with HGV drivers driving all day long. They'd have the window open and they get dryness just in their right eye. It's always just the one eye. So the thing to do really is, again, speak to your optometrist about that. There's lots of products on the market. You can get various lubricants and things. And simple things as well. Just hot compresses on the eyes is very good, often for some types of dry eye. Diet can also help as well. Supplements may be helpful. But yeah, speak to your optometrist about that, because that's definitely something they can give you advice on. They'll probably want to examine your eyes to see what type of dry eye you've got, so they make the right recommendations for the treatments. But yeah, it's certainly something that can be helped.
Right. Well, I think we've come to the end of our question and answer session. So I really do appreciate the fantastic information. What I will do is, I know Henry had a link put on his presentation. I will put that on underneath the recording so people can be able to find that if they want to as well. But like we've said, all the presentations have been recorded. So if you want to see them again or catch up and freeze as you're going along, then you're very welcome to do that. Today's will be uploaded shortly. So we've got a week of webinars you can catch up on from all different subjects, from the risks faced for older drivers and safe driving tips, to considering an electric vehicle, driving appraisals and assessments, understanding notifiable medical conditions and driving with dementia, dash cams, and then today's obviously eyesight and diabetes. So I think we've given you a good broad support of information this week. We will be running further webinars in the future, so keep watching the Older Drivers Forum website. If you want to know when the new ones come up, then go to the website and there's a follow button and you'll be notified when new ones come up. So just click on that follow button. So at the end of the webinar, there'll be a short feedback survey. If you could just complete that for me, that would be fantastic. I really do hope you've enjoyed it. You will also be sent to the Older Drivers Forum website at the end of this. Have an exploratory look around the website. Lots of useful information. We talked about driving at night, for example. There's a video on there about driving at night and how to avoid that glare, looking down to the left and things. So we've got videos like that to give you help and support on all different manners and support things. So I'm just going to say thank you ever so much to Dilwyn and to Henry for their fantastic presentations today. Really thorough knowledge in there, and it's brilliant to have the experts here to help and support us. So I much appreciate you help supporting. And this week, as we said, was supporting all about Project Edward, because ultimately we want to do is make the road safe for everybody, and we want to have every day without a road death. So please stay safe, drive carefully, and thank you very much. Goodbye.